The physical, cognitive, and socioeconomic effects of drug and alcohol abuse by mothers while they're pregnant, the effect of that on infants is rather staggering. Particularly in fetal alcohol syndrome, the physical effects can range from the baby having a small head for body size, the baby just generally having a small stature than other babies of the same age. There are facial characteristics that are specific to fetal alcohol syndrome. They can range from a rather thin upper lip to slits for eyes. The eyes will be spaced farther apart than are typical. Um, uh, the babies may also have a flat nose. So those are the basic facial deformities or characteristics in a baby that's suffering from fetal alcohol syndrome. But there can also be heart defects and even joint defects found in these babies. And they also are found to have clinically significant brain abnormalities as well as neurological symptoms. These babies will experience withdrawal in some instances. Probably more than not, they'll experience some irritability, some tremors, difficulty feeding. There's an aversion to external stimuli. These babies are not content. They're not quiet, easy babies to take care of. They're also found to have some global cognitive defects or deficits, some intellectual deficits, moving from one stage to the other in terms of development is typically more difficult, and these babies are found to be in lower percentiles in terms of where they should be in their infant development. Actually, they're usually found around the third percentile or lower, so they're pretty low. And also, just to go back to size for a minute, they're also usually in terms of the growth chart, these babies are found in the lower 10th percentile, so they're significantly smaller than most babies of the same age. And the socioeconomic effects of a baby that's born with fetal alcohol syndrome, just in terms of infancy, is enormous. These children can be removed from the home. So there's the burden on child protective services. There's a burden on the mother, but the baby's victimized first by a mother that's abusing alcohol, and then they're victimized again by a system that's not equipped to deal or just can't provide those initial basic needs that all babies are entitled to receive just by virtue of being human. As Erikson's theory of psychosocial development describes, these babies, or all babies, are in stage one, which is that foundational stage for later development. And the foundation that's required from stage one in terms of the trust versus mistrust development is key. How it does a baby develop trust? The baby knows that the caregiver or the mother, typically the mother, is going to meet their needs for food, shelter, and love. Typically we think of survival needs as only, I need to be warm, I need to be cool when it's hot, and I need food and water. But love is an integral component to development. And the baby in this stage, if the baby can experience these three things, the baby will then trust the caregiver, which is paramount for later life. If I can't count on you when I'm hungry, the baby's basic survival instincts are, I'm hungry, I need to be changed, I need someone to pick me up, I need love. And when those needs aren't met by the mother or the caregiver, those, in this case, I would like to just focus on the mother. the baby's the baby does not trust the mother, and that relationship is going to be undoubtedly affected from this point forward. Now, if a baby's removed from the home because of the mother's continued abuse of alcohol, and it's not a safe environment for the baby to be in, then the baby suffers even more, because we have a break in the caretaking. We don't know, is the baby in foster care? Is the baby moving to another relative? So, in terms of a typical infant that has a mother that's capable of providing food, shelter, and love, these babies are really getting shortchanged. Even if a new caretaker takes over, there's still that break. There's not consistency. So, and then, for example, if the baby is being cared by someone else, whether it's foster care or a relative, and then they're later reunited with mom, well, the trust has not been there. So we have to start all over again, which creates, an entire new spectrum of problems. Now, in terms of illegal drug abuse, I would like to just discuss cocaine, methamphetamine, and heroin. Those are three of the most toxic drugs that a baby can be exposed to while in the womb, and the effects are enormous. Particularly in terms of neurologic and gastrointestinal problems, there's a laundry list of symptoms and problems that these babies endure at their smallest point in their life. They're just, at their most vulnerable. They're born into tremors, irritability, increased wakefulness, high-pitched crying. They can't relax. They have an increased muscle tone. They have hyperactive and exaggerated reflex responses. They may suffer from seizures. There's frequent yawning and sneezing. And those are just neurological symptoms that we may see as healthcare providers in babies that are experiencing withdrawal. They're actually addicted to the substance, particularly in cocaine and heroin. Cocaine and methamphetamine. There's definitely an addiction the baby is born with. These babies, in terms of gastrointestinal problems, they're not going to feed well. They're going to have vomiting. They're going to have diarrhea. They're not going to know how to suck properly. They may be able to take a bottle, and then they're not going to be too sure about it. Or they're going to latch on and not want to let go. They'll often be dehydrated. They'll have poor weight gain, and all of this as a result of not being able to do those things. Those things that babies are born with. The survival instinct is disrupted, so they don't know how to suck, or they can't do it consistently. They're very agitated. So think of yourself agitated as an adult. I'm upset, I'm angry, I'm frustrated. The last thing I want to do is eat. Also, these babies may be found to have fevers a lot, or they're inconsistent body temperatures. They sweat a lot because they're in withdrawal, just as an adult drug user would experience, only they're much, much smaller. The babies, they may also experience some mottling, which is like a discoloration of the skin. And again, the body temperature is going to fluctuate just to a certain extent because of what they're going through. Now, there are some differences in the physical and the physical effects in terms of between cocaine and methamphetamine and heroin. Typically, cocaine and methamphetamine the babies will suffer similar effects. They'll be smaller, as with fetal alcohol syndrome. Their motor development skills will definitely be affected. It will be impaired. They're going to have the small head size, and they're going to be tiny, just as in fetal alcohol syndrome. There's also congenital defects. Again, there might be heart problems. There's studies that show abnormal encephalographic findings, which is the way that the brain functions. In terms of heroin, these babies these babies experience some pretty significant withdrawal syndromes, as what I kind of just described. And you have a crying baby, an upset baby, an irritable baby, a hungry baby, a baby that can't sleep. And then in terms of cognition, again, the cocaine and heroin, now they will have impaired behavior and difficulty with concentration. And again, we might not see the full effects of this until a baby moves beyond stage 1, Erikson's stage 1. We're going 0 to 17 months. But at the same time, we know that, well, the natural instinct of a baby to suck, if the baby's not sucking on a bottle, if a baby's, or sucking continuously, this I think would demonstrate some sort of disruption in brain function. The baby's not sure. The baby doesn't know how to get that basic need met. It's something that the baby's born with naturally, and it's been disrupted because of drugs. And also, with regard to methamphetamine, the cognitive effects, long term, these babies will suffer from ADHD, anxiety, depression. Studies have shown later in life that these babies have gone on to suffer significantly in terms of mental health, and as well as long-term behavioral problems, all of which I've pretty much touched on. The socioeconomic effects on these babies is tremendous. The labels that we put on them as a society, crack baby, coke baby, they stigmatize these babies, they marginalize the babies, and they endanger the babies. These babies, in terms of not being cared for, they don't deserve it. The reason these babies are small in size and suffer physical and cognitive effects of illegal drugs is because when they're in the womb, they're subjected to these drugs, but the mother's not taking care of herself. So the mother, some of these effects are kind of, it's like a cause and effect. The mother is not feeding herself properly, so therefore her baby's suffering from malnutrition as well. And maybe the mother hasn't received prenatal care, so she, the baby's going to suffer in that respect also. Another tremendously disturbing and sad fact is that many of these babies, when they are born, and as I just described, they're born with a wealth of symptoms, problems, all of which aren't initially going to be evident when the baby's in the hospital. But many times, if the mothers continue to use drugs, they're not able to take care of the baby, or the baby's physical manifestations as a result of the drugs doesn't allow them to leave the hospital. There's nowhere for these babies to go because they're in foster care, or it's very difficult to get these babies in the foster care system. Nobody wants a crack baby or a coke baby. That's the mentality, that's the stigmatization, that's the marginalization of these babies, and that's the endangerment that we're posing on them as a society by putting these labels on them. So if we can't find a place for these babies, there's no one to provide care. Where do they go? They stay in the hospital where they were born, sometimes upwards of 2 years. And they, again, are subject to another label, the label of border baby, which means that these babies, they stay in the hospital, and yes, their need for shelter and food is being met at a minimal level. But they're not experiencing love in terms of the love that the mother-infant bond can and should provide. They're experiencing care. We don't know to what level. I'm sure there's excellent care provided. But this isn't to kind of, put a negative spin on hospitals caring for these babies. It's the least that we could do as a society. But again, these babies are continuing to be victimized by being in these situations where their 3 basic needs are not being met. Yes, we're meeting shelter and food, but we're falling far short of love. And as Erickson described, this is key to that trust and mistrust. Is my baby going to grow up to be a trusting person, know that he or she is loved, and then be able to develop and continue on in life in a healthy manner through the subsequent stages? Or is my baby going to be unsure, irritable, small, malnutritioned, and not able to give and receive love? I think these are all legitimate consequences, things that we should question. So in terms of general social work practice, I think that my job as a clinician would be to be educated on fetal alcohol syndrome, on the various drugs, what are the symptoms, and where can I get help how can I help a baby that's so small? Well, I don't think I can help the baby without helping the mother or the family or the system that's caring for that baby. And by system, I mean healthcare system, child services system. I think they're all kind of interwoven in this case. The baby's still very much a part of the mother in infancy, and I don't think that we can separate the two. So there are many, many, many organizations out there that are established and are able to provide interventions to educate parents, educate caregivers on how to care for these babies, why these babies are behaving the way that they are, and how we can soothe these babies. I actually found a couple of organizations, that are in they're national, but they do provide statewide services, so you can access a multitude of different organizations that are available to help in these situations. And many of them, as I just said, they don't treat just the infant. In order to improve the quality of life that these infants have, we need to improve the quality of the mother or the caregiver, whomever that is. And in order to do that, there's layers of interventions that we need, from parent education, sobriety, infant care, and not just, now we're not just understanding, we're not aiming to understand a normal healthy baby. We're aiming to it's a tall task, because we have to explain to we have to educate a person that is already compromised by drugs and alcohol on how to provide for the basic needs, again, of food, shelter, and love. How do they give that to their baby that's very frustrating? So it's difficult, but there are many resources out there, and I guess that's all I have.